Hi, this is Dr. Jim Anderson at Anderson Podiatry Center for Regenerative Medicine, here to talk about a very common problem that could be affecting you, and this is arthritis. As you get older, just from wear and tear and having a good life and being active on your feet, oftentimes you're going to end up with some arthritis in your foot. It could be in many different locations. And you may be concerned that you're going to come in and maybe a doctor is going to talk to you about surgery. Maybe they're going to talk to you about fusing a joint, or maybe they're going to talk to you about removing the joint and putting an implant in. Those can actually work pretty good, but there's a lot of layup and there are some risks involved. Here at Anderson Podiatry Center for Regenerative Medicine, we want you to know that for many years, and we were probably the first place in the Rocky Mountain area to use regenerative medicine to repair your arthritic joints. In the beginning, we were doing it with your stem cells. We were processing your blood, we were drawing your blood down, and in our surgical center, we would process it and use your blood for your own joints. More recently, we're using something called AmnioFix, and that is derived from placenta cells. Mothers that go full term actually donate the placenta. This is FDA approved, it's very safe, and we can do it in the clinic. In either case, you're able to walk immediately, and oftentimes you're back to regular shoes within 2 or 3 days. And we've had very high success rate. And why we have such good success rate for your foot is because of something I call the unfair advantage. And all that means is we know from studies that cartilage does not want to repair very well when there's vertical load on a joint. So an example of that would be a knee or hip. But in the foot, this is like a suspension bridge. There's very little load on these joints. Big toe and in these joints in this area, which by the way, commonly can get arthritis, we find we have very high success rate. So I want you to understand that and try not to compare it to these other joints because we have a whole nother ball game in the foot itself. So please consider that as an option. Very little risk, very little layup, and I invite you to give us a call or visit us at AndersonPodiatryCenter.com. Thank you.